September is National Atrial Fibrillation Awareness Month, and here to tell us all about it is Dr. Bharath Rajagopalan. Thank you so much for joining us.
Thank you for having me.
So for those who may not be aware, explain to us what atrial fibrillation is.
Atrial fibrillation is a common heart condition which can cause irregular heart beating, which can lead to stroke, weakening of heart, and other heart-related complications. Nearly 1 in 10 Americans above 65 years of age have atrial fibrillation.
And how is AFib diagnosed?
AFib is a hard condition to diagnose because we got to catch it when it's happening. And the best way to catch it is to get an EKG when you have symptoms. Recent advances like Apple Watches and Fitbit have all helped us to find more and more atrial fibrillation, but there's still a lot more work to do.
And you mentioned some of the symptoms. Explain to us what some of those are and how this can be treated.
The irregular heart beating can be asymptomatic, but when symptoms do occur, they include dizziness, heart palpitations, shortness of breath, and fatigue. The treatment of this condition involves medications and a minimally invasive heart procedure called ablation. And patients with atrial fibrillation need to be on blood thinners for their lifetime in most cases. And recent medical advances like a Watchman device which can be implanted within the heart and can reduce the risk of stroke. And we here at Prairie Heart Institute at St. John's Hospital have been doing these procedures for a decade and then done hundreds of cases. In fact, we were the first hospital in Illinois, south of Chicago, to do this.
Excellent. Well, thank you so much for sharing all this information with us for National Atrial Fibrillation Awareness Month.